Good evening, everybody. How are you? Oh my goodness, I am so excited. This is the first live that I have done for A Plus Medical Billing and Consulting. So, for those that are new to my brand, I'll kind of explain who we are and what we do. So, basically, A Plus Medical Billing and Consulting. The first part is self explanatory medical billing and coding, right? The second part of my business focuses on the patient. I've been working in what my industry would consider the claims revenue cycle management portion of healthcare for about 6 or 7 years now. And what that means is that I process the claims, the authorizations, the referrals, and I'm very well educated and versed um, on the subject of Medicare and healthcare benefits and how they are processed and managed. So, with that being said, with all of those years of experience, what I did realize as a deficit and what could help improve the what could help improve to streamline the revenue cycle process would be to educate the patients. Because as a medical biller and coder, and this speaking from the perspective of the providers and on the healthcare workers field, I have personally spent half of my day answering calls for patients, which is fine. I'm more than happy to do that. But if I have a certain quota to meet as a medical biller and coder, and I have to make sure those claims are filed timely so that the providers can keep getting paid, so you can keep continuing, so that the patient can keep continuing getting service. That's how that. So if all of that is falling to the wayside, nobody wins, right? So what I identified is, why don't we help them, which helps us, which helps them, help everybody, right? So, patient and caregiver education is a big deficit. All right. Most healthcare providers or anybody that work in the industry, they do not, most do not dedicate extra time and resources to educating and providing resources and advocacy for the patients and the caregivers. Um, and it's okay, it's a human thing. Sometimes when we don't have like an immediate gratification or reward for something, we may not necessarily see the benefit in investing our time, energy, or resources into it. But speaking to the healthcare providers, as I just said, your staff spending half their workday answering patients' questions, and it's questions, with all due respect, the patient should know. The healthcare carrier, the health plan benefits carrier, sent them a really big book with all of their benefit details. And for the patients, this is referred to as an evidence of coverage. A summary of benefits is just that, a summary. But an explanation of coverage is going to give you a detailed account of what is included, what is not included, and just an overall general perspective of your plan limitations. But unfortunately, I started off as a member services representative. And I hate to admit it, but one of the first things they taught us is, hey guys, listen, job security, right? We send them these big books. Every year they sign up and they don't read them. And it's okay, because if they did, we wouldn't have to hire you guys to answer the phones. I mean, while it benefited me, it still just didn't sit right with me. So what I started doing, they came to me a few months later and asked me, did I want to get on a project helping to adjudicate unpaid claims? So I did that. As very much as I could, because it taught me basic things. Medical billing and coding is not simple, but they taught me enough to help move things along. But me being the inquisitive person that I am, I'm like, what do these codes mean? Like, what is this? How does this work? And I tried to do the hands-on part of healthcare, and I don't have the stomach for it. And I still want to help. I still want to be in the fight because I come from a family full of nurses and healthcare providers. And I'm very proud to join the fight because it is a very humbling and noble honor to be able to take part in the delivery of the healthcare of another person, that a person even entrusts you with something so special, right? So, listen, I'm so passionate about this. I can just start going off into all these different directions. But listen, the point is my niche, what was going to make us unique as a medical billing and coding company, we were going to pay just as much attention to the patients and the caregivers as we do the providers. Duh, because it helps them, it helps us. As my fiance says, one hand washes the other, both hands wash the face, right? So I try to, this is one of the mantras that I try to guide my steps by on a daily basis. It's very important to me that in my business, and although these are personal business endeavors for the profit as far as the medical billing and coding is concerned, it was still very important to me that whatever it is that I was doing, it actually was helping somebody. So I sat really long and hard, and it took me a few months to come up with it, but I figured it out. Patients and caregiver, healthcare education and benefits. So what I did is I started creating free online videos and resources to these patients and caregivers to kind of nudge them in the right direction and give them some information that I feel like they need to know as a medical biller and coder and as the individual that's processing these transactions and speaking to the patients or caregivers. So you guys might see me waving my book around. This is my really cutesy book. When I'm up and I'm planning and I'm awake, this is how she looks, right? Whew. And when I have ran my brain rapid, guys, I just do one of these and I put it down. Because the reason why is because I want to go back to it all night and I'll get these moments of motivation. I just go, 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 go. And when I do this and I look at my book and I start to get it, that's my reminder to give it a break. Because if I don't get rest, I can't pour from an empty cup and be able to provide you guys with the resources that you need. And to be honest, I've been struggling to get this point across that I've been trying to get across, but I've never been the one to need backup dancers or singers. I can blaze my own trail because for me, it's not about the quantity, it's about the quality. And if in the duration of what I'm doing, I reach a few, that's still good enough for me, right? So back to what I was saying. This is my little notebook of notes whenever I get moments of inspiration or things that come across my head, different content that I want to add to my different pages. I put it in here. And since I'm on that subject, A plus billing and consulting.com, you can find free online videos and tutorials there as well. I do have a Facebook. You can do at A plus consulting 18, or you can just look up A plus medical billing and consulting. Hopefully you are led right to me. Either way, I am always 24/7, even in my sleep. And I set up my website this way. Help is available 24/7. Now, I'm a human being and I might not be able to respond um, right away, but I'm always going to respond within 24 to 48 hours. My website, my social media page, my business email, free inquiries 24/7, forever in time. I don't charge anybody for the enrichment and the knowledge and the enlightenment. Now, if you would like a private consultation, I think my assistant put out a special now that I approved. I'm so sorry. I almost don't know what I sign off on these days. But I think there's a special right now for the private 30 to 45-minute consultations for only $25. And if you can afford it, it's fine. I very frequently update the website, my social media, and I'm working on being more frequent on YouTube. I very I very consistently am adding to different platforms updated information and useful resources. Back to the book. I wrote some stuff down I want to talk to you guys about that I want to make sure I cover. Now, this video has been going very well for the first 10 minutes, but I'll be honest with you guys. I am a single mother of six. Therefore, my house is usually up in arms all the time. Oh my God, the fact that I have gotten 10 quiet minutes with you guys without them running to the door and bombarding me with the mommy, mommy, mommy. So I'm going to try and hurry it along. I give myself another five good minutes. All right. Or before my fiance comes in from his store run so we can start dinner and all that good stuff. So let me open my book. I want to cover a few topics. First, I'm going to go over different facts and important information for those that get their healthcare benefits on the marketplace or the exchange. And then I'm going to go over some facts that are relevant to people that are eligible or are receiving Medicare. Right. So let's try and move into this. I'm watching my timer. I told you I think I got 5 minutes or less before my kids come. Luckily, COVID opened up. I'm sorry, no disrespect. I'm sorry to COVID, whoever it affected, whoever lost a loved one. But some good did come out of it and just open up a whole world of different possibilities. So here I am in my home office, my homemade studio where I do different live broadcasts and videos and podcasts and streams to provide not only entertainment and connection to people, but different jewels, trying to add value to my many different brands. Domestic Marketing Enterprises at DME 2015 on Facebook. And you can find the website link on the Facebook page. A Plus Medical Billing and Consulting. I have House of Ari Mescanet. That's an African word for karma. That's a nonprofit that I'm still trying to get off the ground. My fiance has Bolo Enterprises LLC. So we very purposefully are trying to keep ourselves busy and just all the way in on all these different projects because we're very passionate about the things that we're putting out here. So back to the topic at hand, right? And I can't wait until because I see nobody's live now, but I know and I'm hoping a lot of people are going to go back and watch it. So I'm hoping, I get to the point where I have my audience up, people are commenting, and I'm able to engage with people. That's my dream, guys. Domestic Marketing Enterprises does resumes, which isn't so big a thing. I've been doing that since I was about 12 or 13. It was just a really creative way to make money while I was in college and I wasn't working. So I legalized it into a business, but it actually grew into more than that. So for people that are like me, a small business owner, the things that I figure out and learn for myself, if it's just information or a resource, I'm going to share it free of charge all the time. That is not that energy. And I started the Facebook business networking group, Melanin Manifest, on that pretense. There is no charge or exchange or anything needed for me to give you knowledge and enrichments. That makes me feel purposeful and it makes me feel good to give somebody that empower me. It makes me feel empowered that I get past that power, right? So, like I said, back to the topic at hand, I can get really passionate about this stuff I have going on. All right. Healthcare marketplace people. There is more access to consumer assistance in a number of different ways. You have more people available to answer the phone. You're not going to be on hold for hours at end anymore. Not saying that there may not be long hold times, especially during the busy seasons. Also, just because it is not open enrollment does not mean you cannot get coverage under special extenuating circumstances, which they call special. I'm sorry. Listen, I have so much on my brain that I'm trying to write off and make sure I cover that I can even come up with the simplest term that special election period. I'm sorry, guys. Special election period. That's where if certain people have had extenuating circumstances, like they've moved to a different coverage area and that same plan isn't available. And even if it is, you generally still have to change plans because you're in a different coverage area. Every plan isn't available in a different coverage area, whatever that carrier deems the coverage area. Um, Also, the government has now funded the reopening of 57. That is not a typo. I got this info. I do my research before I deliver you guys any information. Even if I think I know it, I go back and I double check myself. And if I ever say anything that is inaccurate, I encourage you to correct me in the most respectful way, please. But I would encourage you to correct me because I want to do it right, and I want to give out the right information. All right. So 57 returning navigator organizations. Guys, that's awesome. If you don't know what a navigator is, a navigator is like a caseworker, right? And they're going to do some of what I do, but they might even have nursing or actual hands-on healthcare and disease management knowledge. I only have healthcare benefits management knowledge. So to have 57 consumer agencies now, and I'm not saying that makes the system perfect, and that doesn't negate any of that. And to be honest, I don't get my coverage off of Healthcare Marketplace, so I can't speak on anybody's experience or what the experience should be or is or any of that. I'm just delivering the information that I've researched that I like to provide to you guys. So we're moving along, right? Oh, I went past 5 minutes. Good job. All right. So, because of the Inflation Reduction Act, 4 out of 5 people are going to be able, after different subsidies and rebates, 4 out of 5 people are going to be able to get them a healthcare plan for an average of $10 or less. That's awesome. So that you don't have plan overload and you're like, oh my God, which one should I choose from? And also to keep the health plan carriers from spreading out all the good benefits so that you have to trade up one for the other. There are only allowed 4 plans per network type. So that means 4 in-network plans, 4 out-of-network plans, 4 vision plans, 4 dental plans. And if you ever see any provider doing something or you're not sure if this is exactly right, what's going on, never hesitate to call 1-800-Medicare, Medicare.gov. You can always go to A Plus Billing and Consulting. I'm more than happy to answer any questions if I don't already have the answer or the free resource listed. Okay, if you are on a silver plan and you don't choose a different plan by December the 15th, you're going to be auto-enrolled into that same plan or the highest comparable plan that following plan year. Okay. And one more fact I have written down. I have to try and decipher my own handwriting because I was, it's when your thoughts move fast, your hand and the pen doesn't move as fast or swift. Consider all costs. Now, the good thing is the way the application is configured now, whether it's over the phone or online, the way the questions are situated, it helps you choose the correct plan if you don't really know all the details behind an HMO, a PPO, a PFFS, or just having straight Medicare or straight Medicare with supplement, or retirement benefits from a spouse or from your employer. So many things. And that's another point I want to make. If you have multiple coverages, it's very important to know which one is going to pay primary and which one is going to pay secondary, especially if you have some sort of medical service or procedure that you have to come out of pocket for. Because if it's not a preventative service, there very well may be, most likely is going to be a cost associated with it. Excuse me, guys. I have to wet the whistle for a minute. I'm trying to spit out so much information in such a short time, but I'm actually proud of myself. I thought I was only going to get 10 or 15 minutes in alone. We're running on 20 minutes. We're doing great. Consider all costs. That's my last tip for the healthcare marketplace people. So what that means is that when choosing a plan, don't just make the decision based on what the premium is for that plan. Consider your own personal situation. Also consider could happen, and then filter all that through the microscope of, okay, what does this plan list as the copay for an office fee, for a hospital visit, for an outpatient service or procedure in the hospital or in an outpatient procedure? And I can tell you the trick around that one that I promise you, I will not lie to you, will save you thousands of dollars. Check us out, A Plus Billing consulting.com. And listen, guys, I'm so sorry that the content adding has been slow. Again, I'm working around 6 children. I'm still building this brand. So a lot of the times I'm working on someone else's clout, helping someone else build their dream and make their kids and their generations rich. And I'm okay with doing that. I've read Rich Dad, Poor Dad multiple times, and Robert Kiyosaki worked at Xerox, I think, for about 10 years, give or take a few years. And the whole while he was doing it, because he had to do that to survive, to pay his bills. But the whole while, he always kept his mind on his business and continued to invest in himself, even if it was just a lesson, even if it was just a mentorship, right? And I won't get too businessy here because that is not the foundation or platform for A Plus Medical Billing and Consulting. For all the businessy talk and lingo, that's domestic marketing enterprises. You'll find those interviews, videos, and lives on our Facebook page or on the website. I have not yet created a YouTube channel for that business line yet, but I'm making my way there. I'm young. I'm only 35, but I'm still catching up to the social media swing. All right, so I want to move on. Let me get a sip of my tea. I'm sorry. So now let me move on to the Medicare recipient or Medicare eligible or possibly eligible recipients, right? One thing I always like to mention, if you do not have existing, what they call credible, and don't ask me what's the difference between the credible and the incredible or uncredible. I don't know. But the way they word it is, and I probably should know. Hold on. Give me a second. What's credible coverage versus non-credible coverage? Because like coverage is coverage, right? See, you guys are going to learn and grow with me. This is going to be a genuine, authentic experience. Excuse me. If I have a question myself or if I'm not sure of anything, I'm going to be totally honest with you guys. Please trust me to never lead you astray. And always still fact check whatever I do tell you matter of factly, because I am human. There's still room for error. In my opinion, maybe only 1 to 3%. I'm joking. But still, no matter who you're talking to, what subject we're talking about, and in whatever capacity or however big or minor, that always do your own research. And it's not because you distrust that person, but that's just doing a service to yourself. And be wary of people that get offended because you want to do your own research. Okay. But that's a conversation that'll probably stream on one of my lives on Unapologetically Be. I very much believe in being my whole, authentic, genuine self, even when I'm in a professional mode. You know what I mean? But it's still a professional mode. So I created the Facebook page Unapologetically Be to give my audience, my existing clients and customers and potential customers the opportunity to get to know me. Because what I'm learning in my business journey is that people buy from who they like, right? Because two people, same Chick-fil-A sandwich, but we all know what Chick-fil-A service stands on. And then McDonald's. My baby love him some chicken nuggets. And I'm going to call him a baby. He's 16 now. My oldest is 16. No shade on McDonald's. But I promise you, there is a big difference between the teenagers' customer service at Chick-fil-A and the teenagers' customer service at McDonald's and Burger King, because different expectations and training requirements are put forth. And people are going to go to who they like. The people that are very devoutly Christian, they're going to support Chick-fil-A because they feel like and they know that person shares their same beliefs or ideals on some level. And a part of what they're putting into is still going to go back into something they still believe in. And I think that's one of the answers to being successful out here in business. Make people feel good when they use your service or get a product from you. But again, I won't do too much business talk. I told y'all I can go off onto tangents. Once you get to know me, you will get to know I am a woman of many layers, many interests, different thoughts. Back to the topic at hand. I digress. And as you get to know me, you'll find that I do that to myself a lot because I'm very conscientious of the fact that I can go off into rants and that needs to stay focused. Again, here we go. Okay, so for Medicare, if you are eligible for Medicare and you do not have coverage right now, you might want to second guess. And I'm not going to say do or don't do it because I don't know, everybody's personal situation is different. I'm just trying to provide relevant and what I believe is important information. Everybody needs to interpret it unique to their own situation. So if you do not have coverage, double think, double guess, second guess yourself about whether or not you want to wait to sign up for the Medicare Part A and or B. Because if you do not enroll in healthcare when you first become eligible, which is called your initial enrollment period, IEP, that's the 3 months before you turn 65 up until the 3 months after you turn 65. So it's actually a 7-month period. If you do not enroll when you first become eligible, but then you feel as though 3, 4, 5 years from now, you're going to just pick up and now you're having ailments and you want to enroll, you're going to have a late penalty fee. And there is going to be no way around that. The only way around that is if you can show proof that you had credible coverage with another carrier, continuous credible coverage. Because once you lose that coverage, and let me get this right, I'm going to make a note of this because I should have verified this. I'm sorry, guys. I have so much information in my head. It's hard to keep certain things straight, especially when you're a medical biller and coder. And sometimes I go to sleep and all I see is just random numbers and codes and decimals. It's horrible. All right. So after you lose whatever coverage you do have, you have somewhere between 30 and 60 days to let Medicare know that, hey, I've lost coverage somewhere else. Because if you don't and you wait any longer than that, you're going to get you're going to get a late enrollment penalty. The Medicare Part B premium has went up this year for 2024. That should be of no surprise to anybody. Inflation, the money we saved in 2000 is not the same. It has less value when we spend it in 2024. Unfortunately. But like I said, there is the Inflation Reduction Act that's helping the healthcare marketplace people. I'm going to research a little bit more to see how the Inflation Reduction Act, let me make a note of that right here. How does that affect Medicare recipients? And if y'all see my book, it's so sloppy. Trust me, I'm writing exactly the same way it look like. I have whichever way my hand go, however, and I'm just writing anywhere to make sure I get it down before I lose the thought. And I'm very forgetful too. It might be early on time, as just mentioned. I don't know. Listen, when I got to the point where I was calling one child and I called him every name except his name and then got upset because he didn't know I was talking to him because of the fact that I called every name but his name. I knew I was turning into my parents. All right. But I digress. Let's go back. All right. So the Medicare Part B premium has went up for this year. That's $174.70. Now, for some, depending on what your personal situation is, and if a Medicare Advantage plan will work and suit you, a lot of Medicare Advantage plans are offering Medicare Part B premium reimbursement, either in full or up to about $144, I believe, something in that range. Every carrier and each plan is different. So I just implore you to do your research. Let's see. Oh, everybody's going to get Part A for free. Don't worry. You don't have to pay for Medicare Part A. For those that don't know, Medicare Part A covers your hospitalizations. Medicare Part B, that is your doctor visits, your durable medical equipment. An example, wheelchairs, orthotics, and prosthetics. Um, Part C is you having a Medicare Advantage plan like Humana, Aetna, Cigna, some of the large or small carrier. They lump the A and B together, give you some and the D, add other additional benefits, and there you go. Because they're all competing for your service. The more Medicare recipients they get to enroll with them, the bigger check CMS cuts for these carriers every year. So trust me, and hopefully these benefits are only going to get better and better. A lot of the Medicare Advantage plans now will give you a debit card for spending. You can spend it on rent and utilities, food and produce. And we all know about the over the counter. That's not even, I'm not saying it's not appreciated, but it doesn't even get us excited anymore. The over the counter benefit has been out forever. All of my children receive Medicaid. We've been getting that for years. And those that don't get it, look into it. Almost all carriers, whether Medicare, Medicaid, healthcare marketplace, almost all insurance carriers give you a certain allowance per month or per quarter for over the counter items out of the pharmacy. And if you're not sure how to use that benefit, the best place to start is going to be with your healthcare plan carrier. You're going to call them and ask them, how do I have over the counter benefits and how do I use them? Who are the approved suppliers? Um, one thing I did want to also mention about Medicare Part B, although it is free for those that choose to take it, and it's and all 65 and up, you're eligible, right? There is still a deductible. I try always break things down for you because I know the terminology can get overwhelming. The deductible is the amount of money that you are going to pay out of your pocket before your health plan kicks in anything. So let me give you an example. And we're not talking about preventative services. This is exclusive of preventative services. Because when you go for your yearly physical, there's a $0 copay, right? So we're talking about other stuff. Oh, I stubbed my toe, or I got a splinter, or I need to get some stitches in the office, something like that. All right. So if you have a deductible, say your deductible is $500, even though your office visit copay might be $25 or $15. If your deductible is $500, you still have to spend $500 before you can tap into being able to use that copay. So that means if that office visit and that doctor priced that office visit at $130, you have to pay 100% of that. If the next time you come it's $70, you pay 100% of that, all the way up until you accumulate those $500. Now I'm going to give you guys a tip. Pay attention to your explanation of benefits. And if your healthcare plan isn't automatically sending them to you every time you receive a medical service, call them and request that. Pay attention to your explanation of benefits, because I'll give you a little insider. As a medical biller and coder, my duties overlap, right? And I've worked in referrals, I've worked in authorizations, and I know how to work an encounter from front to end. So if I call that health plan carrier and I need to get an authorization from that health plan carrier, that can only go so many ways. First of all, that health camp, they're going to eat, everybody's different. Some people you can turn it in a day before. If it's an emergency, you can hit it stat. However the case may be, but I digress. As the medical biller and coder, when I call that health plan carrier to verify eligibility and benefits, they give me a disclaimer before they do that. And they let me know that this is only an estimate based on the information I provided them or the billing codes that I told them we were going to use. And that the final judgment of benefits was going to be determined once the claim and any necessary documents or medical records were submitted and reviewed. So what that means is that if you have a service or procedure that needs to be done, and that doctor office tells you, hey, your share of cost is going to be, I'll just shoot out there, and because some people have percentages, which is a co-insurance, and some people have a flat pay. Whatever amount it is, they told you that you had to pay, you go ahead and you pay that, right? But once they file the claim, if once the claim is filed, say it's been determined that your share of cost was less than that, almost never is a provider going to call you up and tell you that they owe you a refund. And maybe you do go to the doctor well enough to just let that balance sit there and then the next couple of visits pay for themselves. But if you don't go to the doctor that often, or for whatever reason you might need your funds, yes, pay attention to your explanation of benefits. It'll tell you what your actual share of cost was after that claim had been submitted. All right. So part A, it's given to you free, but you still have a deductible. You have to pay $1,632 towards your hospital bills before your Medicare Part A will start to kick in. Right? Few more plans. We're making it through. I've gotten much further along than I thought before, any background noise came in. So, all right. Drug plans. I'm doing a live baby for A Plus Medical. Give me 1 second. I'll be done in about 5. Oh, you did a store run. Thank you. Thank you. Okay. So drug plans. Neither Medicare Part A nor B covers drugs if you have to take them or in the eventuality you begin to have to take them. That's what you call a Medicare Part D, right? That should be easy to remember. D for drug. That's your Medicare Part D coverage. So if you do decide to keep straight Medicare and not get Advantage or get Medicare and a supplement, you're going to need a prescription drug plan if you want coverage. Same thing with the prescription drug plan as with Medicare Part B and A. If you don't enroll when you're initially eligible and you don't have coverage during that period that you decided not to enroll, you might incur a late penalty fee. All right. I have one or two more facts on here. The income limit this year, if you are a Medicare recipient and your premium is going to be $174.70, as a single individual, you cannot make more than $103,000. As a married couple, you cannot make more than $206,000. And this does not mean that you won't be allotted your Medicare. It just means that you might pay a higher premium than others. Supplemental plans. I don't see any details under there, so I'm assuming I just wanted you guys to know that that was an option. It's been real, guys. We're going on 40 minutes. We did great. I got a lot of good information out to you guys. It's been fun. Anything else I need to add? I'm running through. Pop, 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 pop. Yeah, and my homework, the next time I come back to you guys, I'm going to have an answer for how many days do you have to enroll in Medicare or coverage once you lose your old coverage. I'll have an answer for you guys on that. And as well, how does the Inflation Reduction Act affect Medicare recipients? Because we went over a couple of different ways that it affects those that purchase off of the healthcare marketplace. So that is it. That is all. And to be honest with you guys, I was actually 2 minutes behind schedule, but I was trying very hard to be diligent and prompt and start at 6:30. 2 minutes isn't bad, especially for me. I know you're like, God, how can you be bad with timing? I very much am. But we've made it. It's 40 minutes. I've crammed a lot of good information. I welcome you guys to visit the website, aplusbillingandconsulting.com. Visit us on Facebook, A Plus Consulting 18. You can watch the Facebook page, Unapologetically Be, to maybe try and get to know me a little better and know who you're doing business or receiving services from. I'm very excited to meet this new audience. This is my first live. I hope this goes well. Guys, even if I get 10 views, I'm going to be excited and I'm going to feel proud, and you aren't going to be able to tell me I didn't go viral. All right. But I digress back to what I was starting to say. Because I was running behind time, I didn't get the opportunity to plug up my little podcast kit that I have here. That I like to use when I'm broadcasting. It has all type of neat different sound effects, parties, wonk wonk, if we're doing game night trivia and somebody gets a question wrong, it has applause, gunshots, running, questions, baby voice, it goes on. And I did want to kind of incorporate this into the live, but it still turned out perfect. Thank you for everybody that is watching or it's going to go back and watch. A Plus Billing and Consulting. If you need help, seek us out. We got you. Right? We're going to blaze a whole different trail, our whole own path. And when you guys look up, they're going to be like, dang, I wish I would have jumped on that shit with those guys. Because those that support the vision now, they're going to get the best of A Plus Medical Billing. I'm going to try and still keep it funky. I'm going to still try and keep delivering 150% every single time. But the reality of it is those that start with us in our growing phase and process and believe in the vision and what we're trying to strive for. And another quick note before I leave off. My fiance is very good at giving me good business ideas. I mean, when I first started, I tried to appeal to Medicare to be a Medicare approved provider so that I could provide educational services to help people manage their benefits. I can't say exactly how they worded the denial, but my fiance inspired me. I mean, at first, when he was giving me ideas, because yeah, a lot of things he was saying, I'm like, man, it don't work like that in this industry. But eventually that did lead him to an idea, a great idea. We should start a petition. Let's start putting pressure on these other carriers, putting pressure on those that make the laws. Make it a law that you guys have to diligently and purposefully and intentfully dedicate money, time, and resources towards educating the patients more on how Medicare works. We can't just send these people or you people really big books with the expectation that we know you're not going to read it and retain any of this information. That is negligent. And we want to be different. Not only do we want to blaze trails and be different in the field of medical billing and coding, we want to make a difference. Our goal, if you go to our website and take a look at the mission statement, my goal in anything that I do is to make the biggest positive impact on as many people as I can. Right? But again, it's still quality over quantity. I have been bidding you guys good night and farewell for about 5 minutes now. And I usually have to do this to myself when I broadcast. Just go ahead and hit the end stream button. Yeah. Good night. Good night. Good night. End. Yep. End. Confirm.